Mercy HealthCare is looking toward the future by using artificial intelligence. Their goal is to limit the load on healthcare workers and improve the patient experience. Our Travis Cummings joins us live from Mercy St. Louis Hospital in Creve Coeur to explain how this will all work. Travis.
Yeah, Mike, it's to make things smoother for the people going in and outside of these doors. Mercy is partnering with their already existing force here, Microsoft, and the corporation actually chose the hospital system because of its existing infrastructure with this type of technology. Now, hospitals leaders from across 7 states met in downtown St. Louis this afternoon, with this being a huge topic of discussion.
That our responsibility is to do no harm to patients, but we also have an obligation to improve operational efficiencies, to provide the best care at the lowest cost, and to reduce clinical burden.
The Mercy Hospital system and technology leader Microsoft are hopping on the artificial intelligence train together. They say it's for the good of patients and the people in their care.
It's not intended to replace our operational leaders, our physicians. It's intended to ease burden.
After a big meetup with his fellow execs Wednesday at Ballpark Hilton, Vice President Joe Kelly told us the partnership comes at a time when healthcare staff are stretched thin. So through a new large language model, they're making things easier. With the new system, patients would be able to ask questions via a chat bot and get help understanding the lab results. The bot would also take patient calls to schedule appointments and recommend follow-ups. And for staff, it'll help them quickly find important information about policies and procedures and locate HR-related answers.
So clearly we are already using AI in a smaller scale. I think this merge could be interesting for a few aspects, including to establish competition between other big vendors.
St. Louis University computer scientist Dr. Flavio Esposito is leading an AI effort across multiple concentrations on campus. He says he's for it, long as it's done with in-depth research.
Any corporation should invest in educating on how to use or not misuse this tool for the greater good.
There are going to be some patients who are very concerned, and rightfully so. It's one of the reasons why we want to make sure we have the right guardrails and protections around that before we deploy anything.
The hope is for these models to be launched across Mercy hospital systems by the middle of 2024. It could happen sooner, but patients will be notified as soon as it rolls out. We're live in Creve Coeur. Travis Cummings, 5 on your side.